Market for Companion Animals. So this is an interesting session because with growing urbanization and growing care for pets, this is a relatively newer market and it's getting more traction in the mainstream. So we're really excited to be on board with this conversation. So I would like to invite on stage the moderator for the session, Mr. Govind Suryawanshi, Director of Corporate Affairs, Royal Canin. Govind Suryawanshi is a seasoned leader with over 20 years of experience in public policy, government relations, regulatory affairs, and sustainability, specializing in food and animal health industry. Holding a PG in food technology and an executive MBA, he's got a lot of insights to offer. Thank you for joining us. I would also like to invite the panelists on the stage. Dr. Sandip Joshi, Head of Animal Health Division at Himalaya Wellness. Dr. Sanjay Joshi is the Business Head of Animal Health Division at Himalaya Wellness Company. With 25 years of experience in animal life sciences across multiple species, he has expertise in sales, marketing, business development, and international business. Thank you for joining us, sir. I would like to invite on stage Mr. Makarand, Chavan, Secretary of Pet Practitioners Association of Mumbai and General Secretary of the Federation of Small Animal Practitioners Association of India. Thank you for joining us, sir. I would like to also invite on stage Dr. Mandar Deshpande, Business Head of Animal Health at Reliance Life Sciences Private Limited. Dr. Sanjay Awaghate, Veterinary Pharmacology from PGIBS. Thank you for joining us. So I request Mr. Govind to take over the session.
And I would request all the esteemed panelists to be seated. Sorry. A warm welcome to all the panelists and coveted members, as well as I would also like to remind all of you, we are really fortunate to have the panelists, which is a combination of technical experts, business leaders, and the veterinarians. So this is an opportunity for all of us to discuss a very important topic in today's discussion, which is therapeutic market for companion animals. Before we start our panel discussion, I would like to remind all of you, and also Linda ma'am touch base upon this particular topic in her speech. Today is a World Animals Day. 4th of October is World Animals Day. And the reason which we are here, it is such a coincidence, as well as it is destined for all of us to be part of this particular day. We wish all the fraternity, friends, as well as to our companion animals, the friends, a big congratulations for this day. The quote is like this: they are just not animals, and they are just not inhabitants which are meant to be on earth. They are equally integral and vital part of this ecosystem, as if like plants, as if like water. So is the case with the animals. With this, I would like to start the session for the day, and then just give me a permission. Yeah, first of all, big thanks to all of you. And I would like to start this discussion, which is very, very important, because the therapeutic markets, which is precisely taking care of the preventive care and health, as well as the reactive care and the health for animals. And I would like to start with Dr. Sanjay, very precisely coming with his experience as well as the overall business leadership into this segment. How do you see the therapeutic market for companion animals, and how big is the overall industry for these companion animals when it comes to the therapeutics?
If you talk about therapeutic has what is therapeutic? Therapeutic is for the treatment of the animal, so that whatever ailment, whatever disease has come, a veterinarian will treat the animal, and the animal will be okay, so that it can live their normal life. It has got two components. One is a regulated product, another are non-regulated product. So regulated products include a lot of list of product Uh, Starting from the antibiotic, we have so many antibiotics available. Uh, in that also there are specialized antibiotic for the veterinary and specialized antibiotic for the human being, because nowadays the antimicrobial issue is a very prominent talk everywhere, and they want to restrict some of the antibiotics which are used in the human being should not be used in the animal, so that uh, the animal can be protected as well as the humankind also can be protected from deadly infections which are having a microbial resistance. Another category of product is a range of product which will minimize the pains, or you can say uh, whatever diseases which are related to pain they are having. So it has got a lot of NSAID product which relieves the pain, especially in the chronic conditions like arthritis, or when the surgery happens, the pain remains for longer time. So animals should be relieved with the pain. So there are a range of product available in the NSAID category. NSAID category is mostly similar to what is with the human being, but there are certain specialized products in this category also which can be exclusively used in the animals, and these are very animal specific products. Then we have a range of parasiticide product, and this is a very, you can say, a growing market worldwide, because as the world has become a, you can say, a global village, so movement is very fast, and a lot of diseases, a lot of parasites are being transferred from one country to another country, and no disease nowadays country specific. So most of the diseases are becoming, you can say, global diseases. So previously there were very few products available, but now this segment is evolving very fast. And now the segment is looking for longer protection. Previously we used to use product which give protection for 1 month or 2 months or 3 months, but now companies are coming with the products which can be used, which can be effective for 1 year also. So these are some of the, you can say, apart from that, vaccine is a very important category, which is important in restricting some deadly diseases. Okay, so a lot of, you can say, research and lot of development is happening on the vaccine front for dogs as well as for the cats. Then now with the lifestyle change in the lifestyle of the pets, because previously pets were living naturally. Now they are living in an artificial environment created by us. So there are some lifestyle diseases are also coming up. So diseases like diabetes, diseases like obesity, diseases like arthritis, diseases like kidney problem. These are the emerging problems which are coming up. So now this is also a growing market for a therapeutic segment. Then because of the diagnostic facilities, previously a lot of, you can say, uh, uh, cancer problem, a lot of tumors were not detected. But now the diagnostic facilities are, you can say, improved. There is a lot of change in the diagnostic facilities in the veterinary science and the pet science especially. Previously, if you look at the clinic in Bombay or clinic anywhere, it was just a small table where the veterinarian used to treat. Okay, but now the clinics are also expanding. Every diagnostic facility is being provided in the clinic to the pet parents, so that they have a unique experience that in that clinic. So with that, now you can say oncology has becoming a very prominent segment in this category. So this is an emerging segment in this category, which is nowadays veterinarians. There are specialized veterinarians also. They are becoming a specialist oncologist, and they are getting. They are also training themselves to how to use this type of product or how to diagnose this type of diseases. So this is a very interesting segment, as well as this is a very challenging segment also, because challenges will come every day, and that's why this need to be a very evolving segment, and this is evolving every day. Thank you.
Thanks, doctor. Since we understood the overall industry as well as the category of animal health with respect to therapeutics, my question to Dr. Makarand, who is a very well-known face into the domain and an expert veterinarian as well as representing the various associations. And a perspective of veterinarian is very, very important in this case. What are the factors which are actually driving this particular sector, especially on the demand side when it comes to the therapeutic, I would say, therapeutic segment is concerned?
Hi, good morning, everybody. I'm happy nobody's sleeping here. Thank you. So I'll keep it quick, and I know there is short of time. So we have the increasing pet ownership. There's a great paradigm shift right from the pandemic. We were having pets, but now it's really remarkable that there are pet parents are more. There are more adoptions. Another striking point is till say 10 years back in our clinics, we had 60% or 70% dogs and 25% or 30% cats and very few exotics. But now, the last few years, the trend is great. We have new registrations. We have 50% dogs, 45% cats, and 5% exotics. So we have even specialty exotic vets also. I think Dr. Shivani is here. So like her, we have a few more who are super specialty. So coming to his question is the pet parents are increasing. The pets are not just a security or it is more than the family member, it is more than the child. So that focus is great with more nuclear families. We have certain advancement in the veterinary medicine and diagnostics also. So many clinics are multi-vet clinics with multiple facilities like ultrasound, X-ray, and a lot of other surgical facilities also. So there is more expenditure there is more focus on from the pets also. Now we have multi-vets clinics. Lot of pet owners are also more aware. They are reading Dr. Google also. I hope they are reading the correct Dr. Google. Otherwise, there will be more confusion. At the same time, we have rising prevalence of the chronic disease. So how people are there in the urban areas, there is issue of diabetes and obesity. I think I have both. We are seeing pets also with diabetes, obesity. Also, the water intake of
Which is into the therapeutics, especially for the companion animals. Yeah.
Yeah, thank you. So, interesting question, and it's very difficult to understand in a crisp manner. So, I believe that therapeutics is an area which is divided into two. One is preventive, and another is treatment. So, one aspect of therapeutics will always be considered as a preventive initiatives in terms of what Dr. Sanjay said, vaccination and deworming and supplements in terms of nutraceuticals and feed supplements, what we typically call it as. Taking care of the dogs and cats right from their early stage of life to the last stage. So these are preventive medicaments or preventive solutions. And therapeutic solutions would definitely mean a few products in terms of where the requirements are, where the concern is, and where the solution has to be. For example, parasiticides is something which Dr. Sanjay said is an area which is definitely the most important area, because majority of the clinics would see dermatological segment as a major challenge. So there are various reasons for dermatological issues, but the most important is associated with ectoparasiticidal or ectoparasiticide infestation. So this is something which is important. There are, of course, solutions in terms of various products offerings, whether it is soap, shampoo, sprays. You have chewable tablets, now recently launched in India. Across the globe, you have various other injectable solutions as well, which would last from a few days to a few months as a therapy. So these are certain takes in terms of what trends are. Of course, lifestyle diseases are a growing trends. So there are very many research initiatives by various organizations in specific areas. Just to give an example, diabetes mellitus is a big problem in dogs as well as cats, and there have been efforts in this direction to control this going forward in a adult dog or a cat. Another very recent trend in terms of therapy area could be monoclonal antibodies for various challenges. We have a lot of issues in oncology where the diagnosis is becoming very easy when the technology is being used. There are various viral infections which are seen in different pets, in dogs as well as cats. So to prevent those as well as treat those, there are different therapy areas or segments which are coming up as solutions. There are vaccines of different kinds for dogs as well as cats, and I would say that this is an area which is the most important part in a pet's life, because these are the points in the initial phase of a pet's life. If not taken care at the right time in right manner, it becomes a challenge to the entire community of the small animals. So I guess some of the therapy areas which are evolving, some of the diseases which are evolving, some of the virus strains which are evolving, I think this is becoming a bit of a challenge, and the solutions in terms of vaccines are to a greater extent coming up quickly. It also brings to one more innovative therapy or diagnostic tool I would consider as a therapy is rapid diagnosis. So point of care solutions in terms of PCRs or enzyme assays, which are diagnostic tools at the hands of veterinarians, which would obviously give them a decision choice of what kind of product to use in what stage. So I guess this is one more interesting area where the viral infections can be detected at a right time, at a right place, and then the solutions can be offered eventually. The last from my side is there are various components such as nutraceuticals which can be looked at as a preventive as well as solution driven approach as a therapy. Just to give you an example, omega-3, omega-6 fatty acid, such a large variety of raw materials which can be used in various segments. For example, whether it is dermatology, whether it is pain and inflammation, whether it is arthritis. So one particular source or one particular ingredient can give a different kind of application. So this is a vast area, therapy and the segments which can be catered to, and I'm very glad to say that the research is happening in every single therapy area of whatever the difficulties that the veterinary practitioner is looking at or facing to is being taken care of by different companies, by their R&D teams. So that's a bit from my side.
Thanks, Dr. Makarand. And this is very important to understand for entire ecosystem partners, especially the areas and the key trends, addressing not only the preventive health part of it, but also the solution oriented part of it. Now I will move on to Dr. Sandip. Sandip brings a vast experience coming from the Himalayas, representing the animal health division of Himalayas. Sandip, we spoke about demand, we spoke about trends. I would like to know very categorically your views on what are the opportunities as well as the challenges which exist for the therapeutic market, especially for the companion animals. I know it's like two questions combined together, but this would really help the larger audience, the perspective from your side.
Absolutely. Thanks, Govind, and good afternoon to all of you. So I'm not born in Himalaya. I have worked in a couple of multinationals before that, so I know the either sides of the approach. But question is very good. As far as challenges are concerned, I would put it into different buckets. The number one comes awareness. Much is talked about awareness since morning, and I'll put both pet owners and the pet practitioners awareness both. And when I say this,
kindly do not consider cities like Bombay, Kolkata, Chennai, Bangalore, Hyderabad. There are cities like Ahmedabad, there are cities like Bhopal, and there are cities like Dehradun, where a pet practitioner, so-called, does a large animal practice during the day, and the evening he has a pet practice. So awareness is really questionable there. As far as pet parents are concerned, what kind of breeds they are having, what is the nutritional requirement it possesses, what are the common issues of those breeds, how frequently they should go and meet their veterinarians. And Dr. Makarand will agree with me that, I mean, many a times uh, having a pet is a fascination. And you know, especially in tier 2 city, अभी तो शर्मा जी ने भी dog ले लिया, हम कब लेंगे? That is also a genesis of having a pet. And then they easily go and compromise with the quality. So another big challenge is price sensitivity. So we are sitting in country like India. We need to be aware of price sensitivity. No matter how they love their dog, once the prescription is given to them, when they go to a chemist shop, if not all, at least 30% of the pet parents I have seen, they are asking, इसका कोई सस्ता substitute है क्या? ये तो बहुत महंगा पड़ रहा है. So this is another big challenge. Number 3, vets to pet ratio. I mean, it's very thin in India. I mean, we need a lot of pet practitioners. And let us not look at these cities again. Go to other cities. I mean, there's a dearth of good pet practitioners who could really diagnose, who could really treat, and give level of satisfaction to the pet parents. Number 4, as briefly touched upon by Dr. Makarand, therapeutic environment in India is a big challenge. There are serious multinational and, for that matter, Indian companies also who spend a lot of resources, a lot of years in bringing one innovative molecule, and they get registered through DCGI, Central Regulatory Authority. It takes 3 to 5 years to bring a new molecule. And provincial drug authorities give this license within 6 months because you are the first one, and second one takes 6 months. And they offer it half the price. And pet parents are not aware this is right or that is wrong. They only see you are selling it 200 rupees and this person is selling it 100 rupees. That brings a lot of challenges. The flip side of all this is also opportunity. So we can't play the blame game saying that pharmaceutical have to take all the owners and they have to. All the stakeholders will have to come together, starting from breeder, groomer, pet practitioners, manufacturers like us, NGOs, everybody will have to come together. They will have to drive a campaign for the awareness of pet parents, and this has to be uniform, this has to be synchronized. A person going to buy a pup from a breeder also gets the same kind of messaging when he goes to a retail shop, mortar or brick or virtual, doesn't matter, or when he goes to a pet practitioner or he goes to some NGO. Messaging should be clear that right kind of nutrition, right kind of medicament, frequent visits to a veterinarian, get right kind of advice and use right kind of product. Another opportunity I see, the rural expansion. We are still limited to 15, 20 big cities of the country. While if you see the report coming out of Amazon, in last 4 months, COVID and post-COVID era, the biggest growth for them has come from the rural part of the country and not from cities like these. And I don't tend to agree that these cities would not have serious pet parents. They would also have. How much these state-of-the-art diagnostic facilities are reaching there? How much these scientific solutions, remedies, as both Dr. Sanjay and Mandar were discussing, oncology, pain relief management, kidney inflictions, liver inflictions, and some of the species are, known to have all these inflictions. How much is reaching there? Last but not least, our veterinary schools have to be really, really updated. And I don't talk about Mumbai Veterinary School or Chennai Veterinary School or Bangalore Veterinary School, but there are veterinary schools, lot of in Maharashtra itself, where pet practice is not the prime activity during internship. They don't get so many cases. They do not have diagnostic facilities. The professors themselves are not so equipped, or probably they have not updated or upgraded themselves to deal with the pet practice. This whole infrastructure needs to be corrected if we want this pet industry is booming, it's growing. But otherwise it will go into a unidirection where just trade becomes a big business. There is a buyer, there is a seller, and that's it. There has to have one authority which can correct things, and veterinary fraternity, both colleges, practitioners like Dr. Makarand, we manufacturers seriously have to come together and think about it. Thanks.
Thanks, doctor. And this was quite elaborative. We understood opportunity as well as the challenges. And while we are part of this discussion, we touch base upon especially what exactly this market is all about. Then we also understood what are the demand drivers as well as the trends and also opportunity and challenges. Now we also understand the importance of all the ecosystem partners, like you spelled out very categorically. It is like a democracy where you need all four pillars of ecosystem has to come together and work cohesively. One last question for all the panelists, which I would like to have your views, especially what exactly is the government doing in order to support this particular industry in totality? And your experience coming from this industry for so many, like 2 decades of experience. Very quickly, I just wanted to take that question and then we will move on, because I think organizers has given me the time alert.
It's a very tricky question, because if you look at the government, keeping pet itself is you can say, in their mind, it's a luxury. So when it comes to the luxury, there is no any discount, no any, you can say, funds to be given to this industry. First thing is that. As Dr. Sandip was talking about, on the contrary, we have a lot of problems, like registration of product is very difficult process in India. And especially for large animals, it's very difficult, because your product should get first NOC from the animal husbandry department, and then it will go to the DCGI. So it takes a very long time in India, and it's very typical process. Still, government is trying to create a single window system, because they have also understood that it's a big problem for the industry. But the reason for that is our industry is also very small. The pharmaceutical industry is very big. The DCGI is handling the whole pharmaceutical industry as well as veterinary industry. So for them, veterinary industry is a small thing. So they have a lot of product in registration from the other human pharmaceuticals. So there they have a more preference because of the pressure from the various. But then in animal health, that pressure is not there. So there is no demand from the consumer, there is no demand from the universities that we need this type of product. So this is very difficult. But I can tell you one thing, whatever industries, I can tell you example of poultry industry in India. It has grown like anything today. It has become more scientifically, but there is absolutely no, you can say there was no attention from the government. It has grown because the private sector, they have poured their money, their funds into the research and development of this industry. So pet industry also, because there are a lot of people, they are behind this. So it is evolving. I am in this company for 35 years. 35 years I have seen a lot of changes in the hospitals, at the hospital level, even at the demand level. The best thing happened to this industry is the COVID. We have never seen 40%, 50% growth in various companies. Every company has grown 40, 50%. And not only that, the humanization aspect, the pet owner, they feel that my dog is not a dog, it's my kid. I have not seen a mother crying if the baby is given injection, but I have seen the ladies crying if the injection is given to the pet. So that much humanization has happened, and the people, they are ready to spend the money. So wherever there is a money, growth will happen, and there will be advancement in this industry. That is, I can tell you.
Thanks, sir. And we can understand the government's support. There is always an ambiguity because it is these are the two separate areas. very quickly, Dr. Mandar, especially your 2 cents on this.
Yes.
The time clock is very much ticking, but I would like
Don't
to
worry.
have a quick.
I'll have a different perspective from what Dr. Sanjay said. So what he said is, yes, was the situation. I come from a different angle. I believe there has been quite a bit of a change in the approach from government of India, especially. The Department of Animal Husbandry has created a executive committee specifically for animal health products. It has becoming relatively easy to register a new product if you want to give a focus. Earlier, there was no appeal. Whatever Dr. Sanjay said is absolutely correct, and this is something which has happened in only last 7 to 8 years. There has been some differentiation or acknowledgement in terms of what efforts the veterinary pharmaceutical industry is trying to put into. You want to register? Yes, you will have a life cycle of processes which you have to follow, which anyway for any other product, whether it is human or veterinary, will have to follow. But from the Department of Animal Husbandry, the single window system, what Dr. Sanjay referred, has been a little bit of a blessing in disguise, I would say. They are looking at it as a industry in toto. Maybe because of the awareness that all the stakeholders sitting in this room have created, or the organizations which are participating in this companion animal space have created, the noise, the value, the amount of association of brand ambassadors have created that kind of a buzz in the minds of even the government officials. They are looking at it as an industry of luxury. Yes, that part is very well known to. But are they really looking at scientific requirements of pets? Yes, that also has been evolving. In fact, they're giving us an opportunity to bring in different strains or different new products from multinational companies who have registered abroad in a quicker manner. I mean, what used to be taking around 10 to 15 years, a few years back, is now coming to us in almost 3 to 5 years. So this is a change which is happening. We are entirety in a transition phase, I would say, in the companion animal space. Of course, the government also looks at the economics. What he said is partly true, that the volume or the business opportunity is not that great that they would spend their more amount of time in this. However, the approach is changing.
Thank you, sir. And one last opinion from Dr. Makarand and Sandip, please. Yeah, please continue. Yeah.
Quickly, pluses and minuses, 1 minute. We need to understand, if we cut the pie of therapeutic market of Indian animal health, 45% comes from livestock, 35% comes from poultry, and only 7% contributes from companion animal. I am talking about therapeutic industry. Government is always inclined toward agri-allied businesses like livestock and poultry. For them, this is, as Sanjay rightly said, is luxury. I mean, people keep dogs and cats so they can afford. But I also tend to agree with Mandar that things are changing. And when we started our career, we saw a molecule coming into India after registration takes 6 to 7 years. Now, within 3 years, we get an innovative molecule. Also, government is, encouraging private sector that why do you depend upon innovation coming from western part of the world? Why can't you have innovation right now? Why can't you have R&D yourself? Why can't you bring a molecule yourself? This is again a challenge which government is throwing. At the end, you are hungry, you will have to cry. If you have a problem, go and approach government. Don't expect government to call you.
Yeah, thank you. I'll be quick. There's a great gap between, and there's a great prejudice also, that government is not started the courses for veterinary nursing and vet techs. Now that's where we need the clinical upgrade. All over the world in Western countries, why we are saying the point of care is a high standard, because they have separate certificate courses for the vet nurses and the vet colleges. Now, as a veterinary associations across India, we are trying our best to have a dialogue with VCI and the Animal Husbandry Department and the Health Department and the Education Department to start these courses in India. Once we have a certificate course by the government for the groomer, for the vet pet trainer, and for the veterinary nurses and vet tech, then the point of care will increase the standards, and then it will be a better world for pets. So we'll do our best. We need your support. Thank you very much.
Thank you. Thanks, Dr. Makarand. And Thanks to all the esteemed panelists for a valuable insights and a very, very wonderful session. With this and the paucity of the time, I would request questions will be taken during the lunch break because we panelists are very much here, and we have one more agenda, I think, lined up, right? Yeah. Thank you, everyone. Yeah. Thanks a lot. Yeah.
Speakers, please hang back for the mementos. So I request Mr. Bharat Peti to felicitate our speakers. So we'll start with Mr. Govind Suryawanshi. Dr. Sandip Joshi. Dr. Makarand Chavan. Dr. Mandar Deshpande. And Dr. Sanjay Awaghate.